I I sit down. I'm not a stander. I would like to stand. I hate standing.
What's up, you guys? Welcome back to my YouTube channel. For those of you guys who don't know me, my name is Chelsea and I am currently a third-year medical student here at Loma Linda University. So I decided to make this YouTube video because if you're anything like me, I knew from early on that I was not interested in surgery in the slightest, and therefore I never got into watching doctor shows. I never really looked up surgeries because I wasn't interested in watching them. And then I've never really been in the OR before because I'd never shadowed anybody who's, a surgeon, because I knew that I wasn't interested in it, which put me kind of in a strange position for third year going into my surgery clerkship. So first off, we're gonna start with the basics. So in any surgery clerkship, the first thing that they usually teach you is how to scrub in, right? They should teach you that. Now, if they don't teach you how to scrub in, I personally am not going to do that right now. But what I will tell you is that if you get to your surgery clerkship and they haven't taught you how to scrub in, and it's kind of your first day and somebody just tells you, hey, go scrub in, make sure you tell them, hey, no one has ever taught me how to scrub in before. Can someone show me? Now, it's very important that you know who to ask. Do not ask the attending physician who is about to do the surgery. That they're not the person that has the time to show you, to teach you right now how to scrub in, okay? So the person that you'd probably want to ask, number one, is probably a scrub tech, because they may have time for you. Now, they may not, okay, because everybody in the OR actually has a job to do and they are there, everybody's really busy, they're trying to get ready for surgery. So you could ask the scrub tech, or you could ask the circulator or the nurse that's there. They may be able to show you. They might also tell you to, like, if you ask someone, just ask someone random, they might tell you, oh, hey, just go find someone and they'll show you, something like that. You could also ask the resident that you're working with, especially if there's like multiple residents in there that are going to be doing the surgery with you. It could be pretty easy, especially if you've already met them and you're with them for that day. Okay, the reason that I'm making this point is because scrubbing in is extremely important. Most surgeries are sterile, right? You are opening someone up and they're going to be exposed to the air, and you don't want to be the one that's exposing that patient to all of your germs, right? So it's very important that you scrub in, and not only scrub in, but scrub in correctly. So that's why it's really important that if you do not know how to do it, you make sure that you ask someone. I can't stress enough how important that is, because you do not want to be the medical student who just comes in there and is ruining everything. Okay, so tip number two, if your hospital is anything like a hospital usually is, it's completely confusing, and it's really confusing to try to find the OR on your own. So another tip is to make sure that you know where the ORs are. If you have never been there before, the first day of your surgery rotation is not the day to try to find it. So you should try to find it at least like the week before. At least ask somebody, hey, like, where is the OR? And then familiarize yourself with the way to get there so that you can get there and be on time. It's very important that you are there on time. So you do not want to be lost and asking for directions on the day of. Okay, so once you have located where the OR sections are, now it's really important that you make sure when you're going into the OR space, there's usually a red line on the floor, or, well, at my hospital it's a red line. I don't know if it's the same at all hospitals, but there's a red line on the floor that tells you beyond this point, it's not all access, open for everybody, right? So beyond that point is where you are going to need to make sure that you are wearing OR scrubs, you have your hair covered, and it's really important because I actually walked in there one time and I didn't have a scrub cap on, and like 3 people yelled at me while I was walking towards the scrub caps. So please make sure you put a scrub cap on. I think it's really important. So you have to make sure that you're wearing your OR scrubs and that you have a scrub cap on, and then you also want to make sure that you are not wearing any of your own personal items of clothing. So you can't wear like your jacket or your own scrubs, I guess, or whatever. You really just have to be wearing just your OR scrubs and something to cover your head, okay? Now the next part is that sometimes people get a little bit confused whether or not you need to be wearing your mask when you go into the OR. Me personally, I usually just put the mask on when I'm going into the OR because I never really know. Usually you really only wear the mask once the scrub tech kind of opens up all the instruments and everything is kind of out in the open and all that stuff has the potential to get contaminated. So that's when you really want to be wearing your mask. However, you don't know what's going on inside the OR for the most part until you walk in there. So I think it's really important to just go ahead and put that mask on and then walk into the OR and see what's going on from there. Okay, pro tip. If you do not know what OR you're supposed to be going to, but you know who the attending is, and you can't find anyone to ask, usually there is a screen where it tells you the surgery that's going to be completed, the attending who's doing it, and the OR number. So if you don't know where you're supposed to go, you can look on that screen and you can find your attending's name, and then you can go find that OR, and you should be in the right place, hopefully. Now, if all else fails, of course, just ask someone at the front desk. They usually know what's going on. That screen also tells you what time the surgery is starting, and it should tell you what time the surgery actually did start. So you will know if they've already started or not. Once you walk into the OR, it's very important that you introduce yourself, okay? You are a random person walking into an OR with a bunch of other random people. They don't really know what's going on, especially if your ID badge kind of is well hidden, or if it doesn't say student on there, like very apparently. At my school, we do have a big sign that says student physician on there, but sometimes, you know, you're wearing it on your waist and people are not really looking at that. They're kind of just looking at your face. So when you walk in there, just make sure that you introduce yourself. You just say, hello, my name is, and I am a medical student. I'm going to be scrubbing in, or I'm going to be watching, or whatever you're going to be doing. Make sure you know if you're going to be scrubbing in or not, because the scrub techs need to know that so that they can get your gloves. Usually I introduce myself to the scrub tech and also to the circulator or the nurse who's sitting at a computer. And the reason that I do that is because the scrub tech probably needs to know that I'm going to be scrubbing in so that they can get my gloves. And then the nurse circulator needs to know, or the nurse or the circulator or whoever it is needs to know who's in the room. Another big thing that you can do is write your name on the board and include your title as well. So if I was going in there, I would say Chelsea Thomas, MS3, right? Because that's who I am. And now people know that I am in the room. Okay, so now you've made it into the room, you introduced yourself. Now what? Now you're just standing there. No, not kidding. So now what you want to do is
not touch anything.
Make sure you
Don't touch stuff.
don't touch stuff, okay? When I say don't touch stuff, I mean do not touch stuff. Don't touch stuff, okay? People get really upset when you come in there and just start touching stuff, especially if you don't know if the stuff is supposed to be sterile or not. So my golden rule is just not to touch anything. I say, hello, my name is, I say, hey, this is my glove size. They usually get the gloves for me. They open it up, and then what do?
I just stand there, just
Boy,
like
if you don't get
Yes, I do. Now, the reason that I usually do that is because I'm so early. I get there early enough so that sometimes the resident may not even be there, but usually the attending is definitely not there yet, okay? The patient may not even be in the room yet. So I'm just there and I'm not touching anything. I kind of just put my hands like this and I stand there and I wait, okay? Now, there are some ORs that have like stools in them, and yes, you can sit down. I would suggest sitting down because, especially if you know the surgery is going to be long, you probably want to sit then because you won't be able to sit later, okay? I sit down. I'm not a stander. I don't like to stand. I hate standing. I don't like to just stand in the way. So I prefer to just sit. I put my chair in the corner and I just sit, okay? That's what I do. Do not touch anything. Can't stress that enough. Don't touch stuff. Okay, so now I'm just gonna give you a quick rundown of what usually happens during the surgery. So basically, the attending will come in and sometimes they'll introduce themselves to everybody. Sometimes they'll just start talking. It really just depends on if they know their team or not. If they don't introduce themselves to you, make sure that you find the time to say, hello, my name is, and then so that they know that you are gonna be in there with them. They know that you're a student. They know that you are going to be watching them, okay? So make sure that you introduce yourself. Very important. So the patient usually rolls in, they come in on their hospital bed, and then usually they'll need help moving the patient from the hospital bed onto the OR table. So you can usually help with that. I usually grab the legs because anesthesia usually is at the top doing the head. So yeah, as a student, it's always good. Like once you see the patient come in, you could just jump up and walk over and say like, okay, like I'll help, I'll grab the legs, and then you just wait for them to count, and they do 1, 2, 3, and you just slide the patient over. Now you've helped. Great, good job. So then after that, they kind of just prep the patient. They usually are like putting in IVs and all this stuff. Some of this stuff is you kind of just watch for, because there's nothing really helpful that you can do in that moment. So you just kind of see it happen. Something that you can do to kind of be helpful is once they move the patient off their hospital bed, you can grab that bed and push it out the room. That'll be helpful just to get the bed out the way. Somebody's going to do it anyways, but if you don't have anything to do, you can always do that. Now the patient's on the OR table and they're just getting, the patient situated, putting in IVs and all the stuff that they need to do. Then next what they're going to do is prep the patient. So they get a little sponge, I guess, and they just kind of like rub some like iodine, I think it is, onto the patient. And at that point, you should no longer be touching the patient, okay? The iodine is kind of like a clean prep thing where it's basically sterile, right? So you should not be touching the patient during or after that event. So sometime between when they start doing the IVs and when they start prepping the patient, you should go out the room and scrub in, okay? I think that one of the important things that you should do is always scrub in before the attending, because once they scrub in, the scrub tech is gonna put their gloves and their gown on, and then you're just gonna be standing there like this for like 10 minutes waiting for them to get to you, because unfortunately you're at the bottom of the totem pole. You're not the one who's doing the surgery, so you're not going to get your gloves on first. So it's really important to try to go out there and you try to scrub in first so that you can be ready, prepped to go. So once you have scrubbed in, it's really important that you understand that now you're clean. So you cannot touch everything in the room. Like, you're sterile, you put your hands together and you don't touch anything. And now you're wearing your gloves. Make sure you keep your hands above your waist. So do like this. You can do a little, I don't know, I Dream of Jeannie or something, I don't know, but I usually do like this, and then I just don't touch anything, just kind of stand there, stand out the way. Okay, and then they're gonna start dressing the patient in some blue drapes, okay? So once they put those drapes over the patient, you can touch the blue, but sometimes you may just be in the way if you don't really know where everyone's going. So you might want to just take a step back and just kind of let everything happen, especially if it's your first time. Just kind of let everything happen. Let them, set up all the stuff, because they might need to plug stuff in, so they're going to be like reaching across you and you don't want to be in the way. So you just kind of take a step back, let that all happen, and then once they're finished, usually the way that I know that they're finished prepping everything is that the scrub tech will bring their table over, and they kind of like have it over the patient's feet. So that's how I know that it's usually a good time for me to step up and be, in my spot to watch the surgery. Okay, so during all that prep time is not the time to ask questions, okay? So don't start asking your attending,
Hey, so what surgery are we doing? And, why are we doing this? What's the indications for this?
That's not the time to ask, okay? They have a lot of things that they need to do before the surgery, and answering your questions is not one of them. So before the surgery starts, they'll usually do a timeout, which is where they say timeout, and then they'll say, hey, this is patient XYZ who is here for this surgery, and these are the indications, these are the complications, these are the medications that they need, these are the fire risks and all that stuff. And then anesthesia and the physician and the scrub tech, everybody will kind of chime in, and the nurses as well, everybody will kind of chime in. And then after that, they're going to proceed. So as a medical student during the surgery, obviously you are not going to be performing the surgery. You're mostly just observing, but what a couple of things that they may ask you to do. Number one is to retract. So basically when they say to retract, they get a little instrument and they kind of like put it into the flap of the skin, and what they want you to do is just kind of pull that back so that they can kind of get like a wider view of what they're trying to see, right? So they'll usually ask you to retract, so they'll just ask you to hold this, and that is probably
the most that you'll be doing in that surgery.
Retracting to me is really annoying. I don't care to stand there and just hold this instrument and also like hold it back, so now I'm kind of cramping up a bit. Yeah, so but it is what it is. Sometimes they just need somebody to help them get in there. So once the surgery is almost done, you'll usually know because the attending or the resident will say, hey, we're about to close, or we're about 15 minutes away from closing, something like that. They'll give you a timetable so that you know, but they're really talking to anesthesia because they're telling them how long they need to keep the patient asleep for. So during the surgery, that's usually your time that you can actually ask questions. Now, make sure you read the room and you don't ask questions when the attending is literally trying to talk to someone else, or they're trying to, you know, do something really hard. Like, you can ask questions, but just know when it's the right time to ask questions, okay? Okay, so the surgery is ending and this may be your time to shine. It was not my time, but it may be yours. So at the end, sometimes they may ask you, hey, have you ever stitched before? Have you ever closed before? Have you ever, like, basically, you know, closed up the patient before? And then you'll say yes, no, whatever, you have or you have not. And they'll say, okay, well, why don't you go ahead and give it a try? And then you may be able to stitch someone up. That would be exciting, wouldn't it? Yeah, it would.
Not for me, because I don't really care.
But for you, that may be really exciting. I personally do not have any interest in stitching people up, and I can't really give tips on, you know, how to do it, but I would say the best way to kind of practice, if that's something that you're interested in, is to look at YouTube videos, get a suture kit, and then practice your sutures. Don't let the first time you practice be on a real patient. Okay, so now the surgery is over and they are ready to kind of leave. So sometimes once the person is closed up, the attending might start taking off their gown and walking out. Don't do that, okay? Just because they took their gown off, don't follow them. I made that mistake once, and yeah, the resident was not pleased with me. I thought that, oh, okay, we're done, so we're gonna leave now, but that's not what happens. So just make sure that you continue to stay scrubbed in with your resident until they scrub out. Usually I wait for them to take their gown off first, and then I'll take mine off as well. Okay, so what they usually do is they finish closing, and then they take the drapes off of the patient, the blue drapes, and they like crumble it up and put it into the trash. And then they kind of like wipe off the patient, because, you know, there'll be blood or whatever, so they'll like clean up the patient a little, and then they will make sure that they gave all the instruments back and, you know, nothing got lost in the patient. And usually at that time is when they'll start taking their gown off, okay? And that is the end of the surgery. So from what I've experienced, once the resident is done, sometimes they'll stay in there and start typing some notes. Sometimes they'll just like kind of be busy doing something, and you're not really sure what to do at that time. So for me, what I usually do is I go and get blankets for the patient. They usually have like a blanket warmer where you can get warm blankets for the patient, because when they wake up, I guess they'll be a little chilly. So that's what I do. Someone told me to do that, so that's what I do. And then the second thing I do is I usually stay there, and while anesthesia is waking the patient up, you may see like some of the nurses kind of like holding the patient's legs and arms down, because when they're waking up from the anesthesia, they'll be like gagging a lot, and like their body's reaction is kind of just to like kind of crunch up and stuff, or like especially like bring their hands towards their face, and you don't want them to do that because they don't really know what they're doing. They could like scratch their eyes, they could pull out their IV, they can, you know, do all types of things. So you can like hold the patient's arms or legs down, and Yeah. Another thing you can do while the patient's waking up is go out and grab their bed from the hallway, because they're going to have to transfer the patient from the OR table to the bed. And then lastly, what you can help with is transferring the patient from the OR table to the bed. Okay, so we're almost to the end of the video, and I just have a few final tips that I want to give you guys. So the first tip is to always eat before you go to the OR, okay? It's really important to eat. On my first day, I forgot my breakfast. We had orientation in the morning, and then it was like 2 hours later, I went straight to the OR, passed out because I didn't eat my breakfast, and that's on me, okay? Make sure you eat, and if you have not eaten, make sure you find something to eat, because I thought, oh no, I forgot my breakfast, but I've forgotten my breakfast before, I should be fine. No, it's not the same. Surgery takes a toll on your body, and it may seem like, hey, okay, but I'm not the one doing the surgery, so I should be fine. No, just standing there takes a toll on your body. I promise, it does. Just standing there. I mean, I was probably standing there for like an hour, and then I was like, okay, I can't do anything anymore. Like, this is insane. So I just passed out.
They ask you how you are, you just have to say that you're fine when you're not really fine, but you just can't get into it because they would never understand.
And that brings me to my next topic. If you do not feel well, say something. Speak up. Open your mouth and say something, please. It's very important, okay? No one wants to see you pass out. And it's not just because, oh man, the medical student passed out and they ruined the surgery. No, people actually do care about you. They care about your well-being, okay? Nobody wants to see anybody pass out. And if, you're not feeling well, don't be afraid to say something. Sometimes people have this idea where it's like, oh no, I'm not feeling well, but I shouldn't say anything because like this is surgery and everybody should just be able to do it. No, they completely understand that surgery takes a lot out of you. And so if you are not feeling well, I promise you are not the first person in the world who has not been feeling well in the OR, okay? Say something. I am begging you, speak up. Don't be like me, okay? I wasn't feeling well, and I started sweating, and I started breathing heavy, and I was like, no, I'll be fine, I'll be fine, I'll be fine.
And then I wasn't fine. I was actually on the floor.
That was so embarrassing. So just make sure that you say something, guys. I can't stress it enough. Please say something if you don't feel well. Now, when you do say something, just make sure that you leave the OR, you scrub out, you leave the OR, you go outside, get a breath of fresh air, whatever it is that you need. If you're not feeling well because of the blood or the smells or all that stuff, yeah, just go get some fresh air. If you're not feeling well because, you didn't eat anything, you're feeling lightheaded, make sure you go get a snack, go to the cafeteria. Do you have a snack? Go get your snack from your locker room. Just do whatever it is that you need to do to make yourself feel better. And don't come back into the OR too early just because you feel like, oh no, like, I left the surgery, I have to come back right away. No, make sure that you're okay first. You really want to make sure that you prioritize your health, okay? Another really good tip is to make sure that you know what surgeries are happening before you get there on that day, okay? Usually, if you have access to your EMR, you can see the surgery schedule, you can see the status board, you can know what surgeries are going to be happening. If nobody tells you, just look it up. So you can see the surgeries, and then you can say, wow, I've never heard of this before. Let me look up what it is. And even if it's something like as simple as a laparoscopic appendectomy, you'd be surprised at how much you actually do not know. So just look it up. You can look up a video, you can look up, the notes, you can look up the surgery steps, you can look up, the complications, the risks of not performing one. Just kind of have those types of things in your mind, especially if you know like that the attending you're working with is kind of infamous for asking students questions. You really want to make sure that you have those answers in your mind. So you already know the surgery that's happening, you know the patient, you know about them, you know kind of their presentation that led up to them being here. And I think that's really important because a lot of physicians, they want to make sure that everyone in the room is on the same page and they know what's going on. They know why the surgery is being performed. They know what happened, and they know what we're going to be doing, because all of that planning does go into how the surgery is performed. Okay, and then another thing that you can do that I started doing after my first week, when they just kept asking me question after question after question after question, and I kept getting them wrong because I didn't know the answer, because I didn't anticipate the questions that they were going to ask me. I decided to ask ChatGPT to give me a summary of questions that are commonly asked to medical students based on the surgery that's going to be performed, okay? So I thought that was really helpful for me, and after I did that, I kind of started getting some of the questions correct. And then my last helpful tip for you guys is to make sure that you know your anatomy. You'd be surprised at how much they actually ask you about anatomy, okay? So sometimes you only have ever seen the anatomy in a book, or I guess on your iPad, or in pictures, you know, just illustrations. You've never actually seen it on a real human. So when you're inside of there, a lot of times things look a little bit different. It's kind of hard to know where you are just based on what you're seeing. So make sure you know your anatomy. Make sure you look up, hey, what vessel supplies this part of the body? Something like that, like just really simple stuff. Even asking like, hey, what layers of skin, or what layers of skin do you need to cut through, what layers of fat, and then just all different types of questions, just like that. Anatomy, anatomy, anatomy. I know sometimes it's a little bit annoying because it's like, hey, we learned this first year, or we learned this last year, and I don't really recall all the anatomy because we learned so much stuff. But yeah, it does come back to haunt you. This next section, I kind of want to talk about how I studied for the shelf, because obviously you still have to take a shelf at the end of your clerkship. So for me, it was really hard to find time to study because I felt like I was getting there so early and leaving so late that I didn't really have the time afterwards to study. But I found that it was kind of helpful to just see like, okay, we have this much time between this patient and the next one, and there's nothing really happening. So let me actually try to sit down and do a couple of UWorld questions. Now I use UWorld to study. Some people like it, some people don't. But for me, I thought it was pretty helpful. I will say that it was helpful, but it wasn't as helpful as it could have been, only because I didn't really have like a primary resource. So I was kind of just learning from the questions instead of using the questions as a way to test myself. I personally do not recommend that strategy because it kind of takes away from the point of practice questions. The practice questions are kind of there to test your knowledge and see if, you know, you're actually learning what you're supposed to be learning. So because I used up all of my UWorld questions, towards the end of the clerkship, I just bought all the NBMEs and just took the practice NBMEs because I felt like that was the only way that I could test myself with using practice questions, you know, modeled more towards how the questions would be. The surgery shelf was extremely hard. I personally thought it was hard. I don't know how everyone else felt about it, but for me, it was really hard, and I didn't expect the questions to be how they were, but at the end of the day, I still passed. And so I think that, you know, just finding the time to say, hey, okay, we don't have anything to do right now, let me go study. If they ever let you out early, take that time to study. Use the time that you have off to study. It's really important because if you're not studying, surgery is a lot of information, and it's a lot of things that it's a very broad topic. It's not like your other shelves like neuropsych and OB-GYN where it's strictly OB-GYN or strictly neuro or strictly psych. It is like, it's just an extremely broad exam because you can have cardio, pulm, GI, MSK. It's just so many things that like, oh, vascular surgery, yeah, lots of, and neuro as well. So all the different types of surgery that you could possibly have, those things will be asked on your exam. It's almost like step one where you just have all these topics and you just kind of have to know a little bit of everything. Okay, so that was kind of just a basic rundown of like how the surgery goes, and then a couple tips for before the surgery. Now for the rest of your surgery clerkship, because obviously you won't just be in the OR the entire time, you'll also be doing rounds, you may go to clinic, you can do a lot of things. So I think that the most important thing to kind of go through this clerkship is to just make sure you know what's going on every single day. If you have access to the EMR, just make sure that you look at the schedule, see who's on the schedule, familiarize yourself with the patients so you know what's going on, and then if you're going to clinic, you know what the patient's coming in for, if they had complications, if they're just coming up for, you know, a follow-up from their surgery, if they're there for an upcoming surgery, you know, just make sure that you know what's going on every day. I think it's really important to just know what's going on because kind of going in blind just makes you seem very unprepared, and it shows. And my final tip is just to make sure that you have a good time. If you're not interested in surgery, this is probably your first and last time ever being in the OR. So just see as much as you can, learn as much as you can, just have a good time. You may see some really interesting cases, and it may even spark your interest in surgery in the future. Now, with that being said, I just want to leave you guys with this. As a third-year medical student, sometimes it's really hard to feel like you know what's going on. You always kind of feel a little bit lost. Every time you just get the hang of it, you start a new rotation and then you just get lost again, okay? And I want to really just encourage everyone who is going into third year or is a third-year medical student and just tell you guys, like, you got this, you're doing amazing. You are not here by mistake. You are capable, you are smart, and you are competent, and you are able to do this. I'm sure that you are going to rock your third year, and I'm sure that you're going to do great on your surgery clerkship. Thank you guys so much for watching my YouTube video. If you have any suggestions, please feel free to leave them in the comments. Also, if you have any questions, leave them in the comments. I'm always happy to answer. Make sure you like, comment, and subscribe so you can see all of my videos, and you can see when I post new content. And then also be sure to follow me on Instagram at Safari Berries so that you can see all the med school stuff that I post and you can interact. Thanks for watching.